Organ transplants have saved the lives of many, and as our understanding of it develops, so does the level of success from these procedures. Due to the overall lack of organs that are available for clinical transplantation, xenotransplantation was developed. This is when living cells, tissues, or organs are transferred between any two species. The University of Maryland School of Medicine took a large leap in the development of xenotransplantation with the process of transplantation of a genetically modified pig heart. As the patient David Bennett was not a suitable candidate for the heart transplant list or artificial heart pump, he turned to this as a solution to cure his arrhythmia. On January 7th, the faculty at the university conducted the transplant and were shocked by its success, and it had, at the time, saved this man from his heart condition. For our heart to beat, the sinus node would send an electrical signal that contracts the heart as the signal crosses the atria and reaches the AV node. When reaching this cluster of cells, the electrical signal slows down, and this allows for the ventricles to fill with blood. As the signal eventually arrives at the ventricles, the heart contracts further and the blood is pumped throughout the body. Unfortunately, this consistent heartbeat can sometimes be irregular, causing a condition known as arrhythmia. The two types of arrhythmia are tachycardia and bradycardia. Tachycardia is a heart arrhythmia in which the person has a fast heart rate, usually one that exceeds 100 beats per minute. Bradycardia, however, is a heart arrhythmia in which the person has a slower heart rate, usually less than 60 beats per minute. Arrhythmia can occur due to heart attacks, blockages in the arteries, diabetes, high blood pressure, COVID-19, and more. Many of these examples can also increase the risk of arrhythmia as they might alter the heart's natural rhythm. This condition can cause stroke, sudden death, and heart failure. Some symptoms to look out for are a racing or slowing heartbeat, anxiety, shortness of breath, dizziness, sweating, or fainting. To avoid the risk of heart arrhythmia, you can always try to maintain a healthy lifestyle by being active, not smoking, avoiding caffeine or alcohol, reducing stress, and eating a diet that is better for your heart. In the case that the condition is too severe, patients would get heart transplants. David Bennett, however, was given a pig heart transplant.
There are two main reasons why pig heart was chosen for this case. First, it is because of its unlikeliness to transmit pathogens compared to other non-human primates, due to its distant relation to humans. Secondly, pig heart anatomy is similar to that of humans, while also being convenient to obtain. First, the pig heart had to undergo genetic modification. Specialists had to knock down 3 immune rejection genes, insert 6 human genes, specifically 2 anti-inflammatory genes, blood coagulation gene, vessel damage prevention gene, and 2 regulatory proteins, and the inactivation of 1 growth gene to control the size of the pig heart. Although the gene editing did help, what was even more crucial was the immunosuppressants given to the patient to prevent further organ rejection. The drug KPL-404 shuts down the production of antibodies by binding to cellular receptors, preventing the activities of B cells and T cells. Once modified, the heart is placed in a nutrient solution before surgery. The solution includes water, adrenaline, cortisol, and dissolved cocaine. Yes, you heard right, cocaine. It is used to prolong heart longevity. When it was tested without the cocaine solution, the heart was failing within 48 hours. Cocaine is required to maintain a healthy heart. Unfortunately, after 2 months post-surgery, the patient died as his health started to deteriorate. On the 43rd day with the pig heart, Bennett was respirating harshly and warm to the touch. His transplant surgeon speculated that he died of a pig virus called porcine cytomegalovirus, but there was no exact cause of death. The virus caused a cytokine explosion, a series of exaggerated immune responses. On March 8, 2022, 2 months after receiving his heart, David Bennett passed away at the University of Maryland Medical Center at age 57.